I always say a budget is a reflection of your values and your priorities, and I think Americans can breathe a sigh of relief knowing this budget shows they have a president who values science and public health. COVID-19 has offered a stark reminder of why we must make and maintain robust investments in public health. Experts at CDC have been on the front lines of this crisis from day one and every day since. We've seen firsthand how critical it is CDC be equipped to effectively collect and analyze data in real time, communicate science-based public health guidance, help communities across the country get tests and vaccines and clear, reliable information to people, and address inequities that undermine the health of people of color, people with disabilities, rural communities, and others. That is why I've pushed for more funding for public health throughout this crisis. The tens of billions of dollars we've provided through 6 COVID bills so far are supporting invaluable public health work at every level so we can finally end this pandemic. It has helped update and modernize data systems needed to track infections, variants, tests, vaccines, and inequities among demographic groups. It has helped fight misinformation and promote simple protective measures that have saved countless lives, like wearing masks and social distancing. It has helped expand our testing efforts, get vaccines into arms, and build partnerships with trusted voices in hard-to-reach communities. And I was pleased to hear the Biden administration announce last week it was investing over $7 billion from the American Rescue Plan through CDC to create tens of thousands of jobs in public health at the state and local level to fight COVID-19 and to help transition some of those workers to permanent careers as public health professionals. With new cases and deaths both down over 80% from their winter peaks, nearly 3 in 5 Americans vaccinated with their first dose, and over a third of Americans fully vaccinated, we can see the light at the end of the tunnel. But even as we get closer to ending this crisis, we know we are not there yet, and we cannot afford to come up short. That's why after years of underinvestment in CDC and attempted cuts to CDC by President Trump, this budget request is such a breath of fresh air. President Biden's request of $8.7 billion would increase CDC's budget authority by nearly a quarter. I've been pushing for more public health funding for years now, and I'm excited to say this would be the largest budget authority increase for CDC in nearly 2 decades. These investments will help us finish strong when it comes to this pandemic, prepare for the next one, and make progress on other public health challenges. Investments in CDC, as well as requested increases for the Substance Abuse and Mental Health Services Administration, will help address the record number of drug overdose deaths and the spike in mental health issues we have seen as a result of this pandemic. COVID-19 has also put a painful spotlight on how racism, sexism, ableism, and bigotry hurt so many people in this country. CDC's recent announcement of a 2-year plan to invest more than $2 billion to work on COVID-19 related health disparities was an important step towards addressing this reality. And the administration's request to dramatically increase the social determinants of health program Congress established at CDC last year from $3 million to $153 million will help make sure our response to health inequities is truly comprehensive. Because there are so many challenges we need to tackle head on. For example, Black, American Indian, and Alaska Native women are 2 to 3 times more likely to die from pregnancy-related causes than white women. And our overall maternal mortality rate is the worst in the developed country. So I'm glad the administration budget request includes $200 million to reduce maternal mortality nationwide and address disparities, an increase of $140 million. It also invests in other public health threats that have gone too long with too little attention. It doubles funding for gun violence prevention research and establishes a new $100 million community-based violence intervention program between CDC and the Department of Justice, and it increases funding for CDC's climate and health program by $100 million. Of course, the challenges we face are bigger than any one budget. Before this pandemic hit, only half of Americans were served by a comprehensive public health system. Our public health workforce had lost 56,000 people, and state health officials estimated a quarter of their workforce was eligible to retire. So we have a lot of work ahead, not just to end this pandemic, but to build and maintain a public health system capable of addressing other pressing public health challenges and, of course, preparing for future ones. That's why earlier this year, I reintroduced the Public Health Infrastructure Saves Lives Act, which would finally end the dangerous cycle of crisis and complacency in public health funding by providing dedicated annual investments in public health. Director Walensky, Principal Deputy Director Schuchat, I look forward to hearing from both of you about how investments like this and like those put forward in the administration's budget request can help families in states across the country. And I look forward to working with my colleagues to make the investments we need a reality. Finally, Dr. Schuchat, I understand you are leaving CDC this summer after 30 years with the agency, and I know I speak for absolutely everyone on this committee when I say I'm grateful that we've had your expertise and leadership helping to see our nation through so many public health challenges. Thank you for your service from all of us.